Breaking news tonight, the coronavirus forcing millions more Americans into virtual lockdown. Fear on the front lines as the wave of sickness appears to be following the grim predictions. Residents now being ordered to stay indoors. Non-essential businesses told to close.
Sometimes I think back and I say, what happened? Where did 2020 go? We were working so hard that we didn't even think of the years, the months, the fun that we had before.
When is it going to be over? Like, this station is done. There's nobody left. Like, who else is going to get sick from here? When is it going to be done? And you just take a deep breath. And especially as the leadership, like, you can't break down. I think I haven't cried about the pandemic until right now, but you don't have the luxury of panicking. You have to keep moving.
There are times when I think after 40 years, we've all worked together as a team to build what Edgewood has become. It felt like we lost so much and we went back to starting all over again.
Most people who work in a nursing home know that Fridays in a nursing home is anything but quiet. And that's the Q word that we never say in a nursing home. But I remember on this particular Friday, wow, it's so quiet. It's so unnerving. Just wanting those days to come back when you couldn't get out of the building on a Friday night. Who would know that what we would want would be the interruptions, the trying to leave on a Friday night and having a family member say, do you have a minute? Or a resident saying, can I talk to you right now? Or a staff member saying, can I speak with you? Who would know that those were really the good old days and that leaving alone on a Friday night would be as hard as it was. And yet, and it was, and it still is. COVID seemed far away. It seemed just far away and not something that was going to certainly impact daily life here at Edgewood. Edgewood is located in Portsmouth, New Hampshire, which is on our tiny little coast of New Hampshire. So the seacoast is very much ingrained in the culture here. And I've been here almost 30 years and our door has never been locked. The day that Edgewood, a facility that not only prided itself on family involvement, but almost in a symbiotic way relied on family involvement to keep the wheels of Edgewood going, closed our doors, to essentially a third of what makes Edgewood Edgewood.
This facility was built in 1993 to serve Armenian community, and it's a life-changing place.
This facility is very unique. Most people who join our team don't quit until they retire. We treat everybody like family, residents, their family members, our staff, and it's truly a home. It's truly an Ararat home, and we've been an award-winning facility for many years. We have been a 5-star facility for as long as any of us can remember, but unfortunately, COVID doesn't discriminate.
March 6th, Friday, and the reason I won't forget is because it was my birthday. I got a phone call from Margarita, and we were hearing all these things on the news about the pandemic. She called and said we're shutting down the facility. I didn't know it back then, but it was just the beginning of the whole chaos and nightmare that was headed our way.
It was the toughest decision to make. Imagine these poor residents won't be able to see their families anymore. And then I can say that we went through hell.
As communities across the country try to stop the spread of the coronavirus, nursing homes repeatedly, particularly vulnerable. Data from the Kaiser Family Foundation finds more than 10,000 people have died from coronavirus in nursing homes.
Everybody was isolated in their rooms. No more music, no more gatherings, no more group dinings.
The corridors were empty. You know, our staff would try to entertain the residents the best they can from the doorways, but it's not the same. We would try to FaceTime the families. We would all give our cell phone numbers out and we would FaceTime the families, but especially when residents have dementia, they don't understand. They don't understand how a picture is talking back to them. It's like, oh, that's my daughter, and that's the beginning and end of it. Window visits were insignificant because some of them can't see, some of them can't hear. I mean, your heart would just break at seeing these families like knock on the window trying to get mom's attention, say, Mom, it's me, I love you, but I can't come inside.
I had this resident and we were watching the news. They were talking about long-term care and she was kind of yelling towards the TV and she was saying, don't they know that we're dying in here? She was like, we're dying of broken heart syndrome.
A lot of residents lost weight. A lot of residents stopped interacting. Those who were alert enough to understand, understood and appreciated and prayed for us and blessed us and thanked us for our efforts and said, you guys are keeping us safe. Thank you so much.
One of the things we needed to do was establish an admission quarantine unit. And so previous to COVID, our West Wing was really the center hub of the building.
Putting up isolation walls was just really strange. I mean, we had no idea how we could really contain, and go in and out and function, so it was kind of, we really didn't know. There was a lot of unknowns.
It was a different world. It was a different facility. Full PPEs, gowns, masks, hair covers, every second hand washing, sanitizers everywhere, every corner.
When you work a 12-hour shift with an N95 on, like your face hurts. I would take it off in the morning and like the lines on my face would be there for hours, almost until I came in the next day.
Things started getting really difficult. We were scrambling to get the PPEs and N95 masks for everyone. There was a shortage everywhere.
Nursing homes across the country are still reporting shortages. A review of federal data by NBC News shows 1 in 10 facilities said they did not have a week's supply of N95 masks. Nearly a third of all nursing homes said they had to wait 3 to 7 days to receive COVID-19 test results.
We ran out of PPE cards. We were ordering through a vendor, but the shipment didn't arrive, and we needed more cards.
We were down to, I want to say we had 30 gowns left. I can remember just the staff talking to my administrative staff saying, okay, you know what, we're going to be fine.
Even with all this protective gear, we had people that contracted COVID by working with residents. You're constantly touching them and holding them, making sure they don't fall, giving them a bath. I mean, there's no other way to do this job.
Tonight, in the epicenter of the nation's coronavirus outbreak, the virus ferociously attacking the elderly.
The grim reality is that for the elderly, COVID-19 is almost a perfect killing machine.
all around us, everybody had a breakout. I mean, the nursing homes were hit so hard. And I even got cocky after a while. I'm thinking, oh, wow, we're going to be one of the few places that didn't get COVID. And then sure enough, a week later, we had our first patient down on the memory care wing that came back positive, and then it hit the wall. Next day, the lady across the hall. The next day, the next room, right down the hall. On the memory care unit, I had 37 residents under my care, and 28 of them got COVID.
You know, none of us even barely slept, because you're always waiting, and you had to be ready. And we reacted fast, and it still wasn't fast enough. And I've been here a long time. I've seen a lot of things come into the building, norovirus, influenza. We've always been able to contain it. We could not contain this.
When we put up the plastic walls, we didn't know what was happening on the other side. When I peeked through, I saw Rosa, one of our CNAs. I felt her fear. I felt her anxiety. Inside her PPE, I could see tears mixed with her sweat. And I go, Rosa, please don't cry. Please don't cry. You're a hero. It takes a big heart, a big devotion to do this.
When I go inside to the room, I'm so scared. But I forgot everything. Somebody was sick in the bed and they needed my help.
It was devastating. The CNA was holding her hand like her daughter, praying for her, and in a couple of minutes, this resident was gone.
God put me there for something. It's so painful. I cannot explain you. See somebody very sick and living. I don't have a word to explain you.
On a weekly basis, I would write like maybe 4 or 5 death reports just because of COVID. It was just a really, really, really tough time.
Tonight, coronavirus exploding coast to coast. The U.S. adding 1 million new infections in the last week alone.
More than 1,300 nursing homes across the country had 3 or more COVID cases, the highest number ever reported in a single week.
Every time you're tested, you think that you're going to harm your residents, that you're going to get that call. It's you. You did it. It's terrifying.
I have really bad asthma. I've had it since I was a kid, and I was scared of getting COVID because I didn't know how bad it would affect me. And then I woke up, I couldn't breathe, I couldn't stop coughing. I got a call from Miriam saying, "You're definitely positive for COVID." Like, it was really scary to think about the people that I care about and that I wanted to be here to take care of.
I had an employee call me and she could hardly breathe and she was in the hospital. And to say that, don't worry about your paycheck, we'll take care of it. Don't just worry about yourself, get better, get stronger, come back. We're thinking about you and we need you and we can't wait for you to come back. And most of them came back. We had 2 employees who passed away. I don't think you can explain that, why somebody passes from COVID. It's kind of bad luck because they were not unhealthy.
Mounting concerns a spike in holiday travel may accelerate yet another COVID-19 surge in the new year. December is now the deadliest month of the pandemic. More than 63,000 COVID-19 fatalities.
Everyone is sensitive to what we call COVID fatigue. People are worn out about this, but we've got to hang in there a bit longer.
Staff were incredible. I mean, we had people doing 12-hour shifts, 16-hour shifts. No one ever went over 16 hours. It's just not a safe thing. And that's where I had managers that would say, basically, tell me where your holes are on the schedule, and that's the shift that will work.
The entire rehab caseload as we knew it disappeared. What were my rehab staff going to do? We became the backup crew. We did everything and anything that Edgewood needed us to do. We would work different shifts. We worked as caregivers. We helped feed residents. We made sure people were moving and walking. We even did exercise programs in people's rooms.
When everything shut down, we lost our dining room, and because our dining room was shut down, we had to get the food to the residents. Some days we had to bring things around the building because areas of the building were sectioned off, and other days we were able to bring things through the hall, but we might not have been able to bring it to a unit. It was like the week later, I made 47 trips around the building, pushing carts and whatever. I walked 29,000 steps on my tracker that day.
Over and over, I saw people going way out of their way to make the lives of the residents as good as they could be, in a time when it was very difficult to do so. But it's what they always did. It's just that they brought more energy to it, and how they sustained it. Pretty astonishing. Incredible endurance.
I feel this place, especially during the last year or so, it's extra special. Staff are very proficient, very caring. They take care of my mom like their own mother.
It's to this institution's credit that they kept their population safe for as long as they did. I was thankful every day that Jill was here.
Well, I'd say it's been a challenge for everybody, just like we're all aware. The record here was really something to be proud of. But one thing that struck me right off the bat there, they kept us continually aware, even when the news was not, it's hard to dress up.
It takes a special person to be able to do this job. It's all about love and helping people. You can't do this job without loving this job.
I went to healthcare because I felt that in here. That's my purpose. And my purpose is to help and serve other people. If there's a wreck on the side of the road, if there's something happening at a baseball game, the people who usually run up are people who are either in healthcare or first responders. That's what we do. And you don't quit on people.
When we went into Outbreak, I told my director of nursing, Miriam, I was all in, and I meant it. I'm a nurse, I took an oath.
You get to the point that you don't think about yourself anymore. You think about your patients to go and give them comfort.
People came in on their days off, they worked extra shifts, because at a moment's notice you could be down 2 or 3 people. The way I look at it is that we were all in the same storm, but we all had different boats.
Our team stayed together. Not a single person quit our facility during the pandemic. They were absolute heroes to show up and to say, this is my responsibility, I have to do this. I'm the nurse, I have to do it. Of course, this is my station, I have to work here. But no, you don't.
I think it just brings a depth to our commitment when either you've had a personal experience or you feel so passionately about what you're doing. And I remember talking to a staff member at one point after a quarantine period ended, and she just said, I just don't know if I can do it again. I don't know if I can go through that again. And at the same time, she's also saying that she knows she would do that again.
Not even one person called in sick just to take advantage of the system that they were given freely. That's what makes people hero. That's what makes good nurse, caring CNA. I don't know, God bless all of them. God bless them and their families, because they did an outstanding job when it was time of need.
You can't teach people to care. I'm fortunate to be here because this is a place that, and I know it sounds like a cliche, but everybody cares.
This is what we chose. This is what we chose to be. This is what we chose to do. Nobody forced us to do that, but we did it with smiles on our faces, with strength, with hope that this will be over one day.
This pandemic isn't completely over for us yet. Financially, it's going to be a struggle. It has been a struggle and it will continue to be a struggle. But if we can build our staff back and get our census back, we'll get there.
Good evening, and thank you for joining us. We are going to begin with that breaking news. The first vaccine for coronavirus here in the U.S. has just been approved by an FDA advisory panel.
A CDC panel says healthcare workers and nursing home residents should get the coronavirus vaccine first.
There is some really good news. New cases of coronavirus in nursing homes across the country fell nearly 90% in 8 weeks.
Here comes the vaccine.
What a day. You should have seen the joy, the smiles on employees' faces, the residents, families.
The day of the vaccine clinic was just a huge high here. You know, when the pharmacist, I just get so emotional, but when the pharmacist showed up at our door, this poor man was in the lobby, and I went out and I was a puddle of tears because there was this like beacon of hope, someone coming in with this life-saving vaccine.
That was the turning point for us, right? It was good enough to be able to finally get out of the rooms because the residents were so isolated and they were so lonely.
This vaccine finally made its way, to the facility, so there was an element of, did this really happen? And I remember that night, just a complete exhaustion just overwhelmed me. And I think it's really important that people process what we've been through. Dealing with this pandemic has required an endurance that I think we just really didn't recognize. And I think it's hard to move forward until you take a few steps back.
I'm proud and happy that I could have been part of what we did.
Those who still come here after what they've experienced, in my mind, they're the best human beings.
Even now as I walk, I see our scars, right? I see where the ceiling is ripped off because the barriers came down. And after we brought down the plastic barrier, our staff were there. I had these massive scissors, and Susan and I we cut the barrier, and everybody celebrated.
COVID-19 has not won, and we have overcome all the difficulties as one family. You feel it. It's in you, in your heart. You have the goosebumps like I have now, and we are here devoted forever.
There's a buzz in the building again. There's a good vibe, there's a good energy.
It's a great place for residents. I think it's a very safe home, and they've done their best.
Now being able to see their families come in, I started crying. Like, I'm getting goosebumps just talking about it. We had a resident that I really love taking care of. For him to be thanking us nonstop because we were the ones that were there, it makes me just love what I do even more.
It's just so heartwarming, it's just unreal.
We should all be thankful for a place like this.
We are forever grateful.
It's pretty amazing when you think about it.
We've gone to hell and back together, you guys. We can overcome anything. It's a good feeling to be stronger, to be faster, to be so much more solid than we ever were before. But I think that's the beauty of it.
We need society's support. The people we take care of here, they need us to protect them. We're still in it, and what we went through at the height of it, our staff needs to be recognized. They need to be supported.
This pandemic has stretched all of us to the max. I'm confident with the team we have and the commitment we have to rebuilding that we're going to get there. It's just going to be a slow process, and I hope we continue to get the support that we need.
I don't hear staff ever using the word sacrifice. I think we did it because these are human beings that we are so privileged to take care of, and they depended on us.